is Dr. Ifeoma Osunkwo. I'm a proud member of ANPA, the Association of Nigerian Physicians in the Americas. I'm a 30-year physician veteran in the space of sickle cell disease, and this means that I'm passionate about teaching, treating, doing research, raising awareness, and advocating on behalf of my patients who live with sickle cell disease. September is Sickle Cell Awareness Month. I hope you enjoy this video that sheds light on the disparities and how significant sickle cell disease is and who it affects and what can be done about it. We're going to address some of the myths about sickle cell disease, and we'll refer you to some opportunities to both volunteer and also raise awareness about sickle cell disease across your networks. So on behalf of ANPA and sickle cell warriors worldwide, I urge you to really spread the word about sickle cell disease and respond to this call to action. 4 things. Number 1, learn more about sickle cell disease. Number 2, share more about sickle cell disease. Knowledge shared is the best kind of knowledge. Number 3, donate blood. People with sickle cell disease need blood transfusions to sustain their lives. It's one of the few treatment options that is actually effective in sickle cell disease. And then number 4, volunteer your time and your talent to the local sickle cell community-based organization near you. Details on how to volunteer with your local sickle cell organization will be listed at the end of this YouTube video. Again, September Sickle Cell Awareness Month. Let's go out there and spread the word. Thank you.
Did you know that sub-Saharan Africa has almost 80% of the international incidence of sickle cell disease? An estimate suggests that at least 100,000 Americans are currently living with this disease here in the United States. Approximately 1 in every 365 African American newborns will have sickle cell disease, and 1 in every 13 African Americans carries the sickle cell trait, and many do not even know their status. Sickle cell disease is the most common genetic disorder among people of African descent, and this illness is classified as a chronic pain disorder which often reduces an individual's overall lifespan by causing progressive organ damage and intermittent vaso-occlusive pain crises, among other complications, to those affected by this condition.
Statistically speaking, there are 3 countries that constitute about 60% of this disease burden worldwide, with Nigeria taking the helm at 37%, and the Democratic Republic of Congo at about 16%, and Tanzania at about 5%. Approximately 50% of patients with sickle cell disease survive beyond the age of 50. That's half living past the age of 50. And the mortality age for males differs from that of females. For males, it's about 42 years of age, and for females, about 48 years of age. We've also seen significant disparity gaps in the course of this disease and the overall health outcomes when it's correlated with specific patient population and relative access to healthcare.
Why should we care? We all play an active role in helping combat the global impact of sickle cell disease. Please get tested for sickle cell, especially if you're of African descent and do not know your status. There are many myths about sickle cell that need to be debunked, but for now, let's just start with 3. The first myth: sickle cell is a Black disease. Although the majority of those who have sickle cell disease are of African descent, sickle cell is endemic to areas with high cases of malaria, including South and Central America, the Caribbean, Saudi Arabia, India, the Mediterranean, and more. Second myth: sickle cell is contagious. Sickle cell is not contagious. In fact, it's a genetic recessive disease, meaning that you need to inherit 2 allele traits in order to have sickle cell disease. Third myth: sickle cell patients are lying about pain. Sickle cell is in fact a chronic pain disorder, meaning that patients are undergoing a lot of pain as they have this disease and oftentimes need medication to help alleviate this pain. We all play an active role in combating sickle cell, so attending info sessions and spreading awareness is all necessary to combat it. As well, we need to continue to encourage for more screening, research, and better treatment options for sickle cell disease.
Get involved. Advocate from wherever you are. Educate those you come across about sickle cell disease. You can write a letter to your local leaders to inspire legislative change. If you do not have the sickle trait, make sure to join and donate blood at your next community blood drive to support blood transfusions. Please take the time to volunteer at your local sickle cell foundation. A list of foundations and community blood banks will be provided at the end of this video. Thank you so much for your support of ANPA and for joining ANPA to help change this narrative.